So the lumbar plexus in general is a form of structure that exists near your lumbar vertebrae, and it arises from the spinal cord. And what happens is that it gives rise to all of the nerves that supply the lower limb. So whether it's for muscles or skin. So anything that you see here arises from the lumbar plexus. So to go into the lumbar plexus, the first thing we have to know is that mm, maybe I can, for better view, I don't need this here really, but just know it's on 89, page 89. It goes to 90. You have individual branches of the lumbar plexus, and 91, 92, 93, and then it's done. So it's about from 93 going back to 89. Okay, so it's 5 pages. I will just
Mm-hmm.
put this here. Mhm. And I will explain it to you in a way that is easy for you. Um, yeah.
And one more thing, in Bible, I didn't see a lot of topics from the our list.
It's like the anatomy Bible.
Yeah.
Yes, I don't know why actually. Maybe I have to check and see, but I think it should all be there, but maybe something's off. I will just check it maybe later. We'll see.
Okay.
Yeah. So, as I said, the lumbar plexus supplies the skin and muscles of the lower limb. It's located in the lumbar region, as we see. And what we know about this is it's located, if we see in the, if we add the psoas major, you can see that the lumbar plexus is inside this muscle. Okay, psoas major. And it's found anterior to the transverse processes of the lumbar vertebra. You can see here, arising from L1 to L4, some anterior ramos. We're speaking about these ones. So L2, L3, L4. This is the lumbar plexus. Okay. So anterior rami of L1, L2, L3, L4. Next, we're going to talk about the branches. The first one we have to talk about is the iliohypogastric nerve. The iliohypogastric nerve, it's maybe hard to find, but it starts from L1. We'll go L1, hence it should be here. It should be here. L1. Yes, iliohypogastric nerve. The iliohypogastric nerve. What we know about this nerve is that it's the first major branch of the lumbar plexus, and it runs towards the iliac crest, right here. Runs towards the iliac crest from L1, anterior rami, and it splits into two things: the anterior cutaneous branch of iliohypogastric nerve and the lateral branch of iliohypogastric nerve. What it arises from? It arises from L1 nerve, or the root of the lumbar plexus. What is it used to do? It has motor functions and sensory functions. The motor functions of this nerve, through its branches, it innervates the internal oblique and the transverse abdominis muscles. That's the motor function of the first nerve of the lumbar plexus. So
Can you
iliohypogastric,
this il- ilio uh, iliohypogastric divides into anterior and
anterior
lateral
and lateral. Uh,
hypogastric?
yes, anterior cutaneous and lateral cutaneous. No, anterior cutaneous and lateral branch of iliohypogastric nerves. These are the two branches of the iliohypogastric nerve. It arises from L1, and the motor function is it innervates the internal oblique and transverse abdominis. And the sensory function is that it innervates the gluteal skin in pubic region. The gluteal skin in the pubic region, posterolateral side. posterolateral. So basically here. Okay.
Mm.
Motor function innervates the internal oblique and transverse abdominis, arises from root L1, splits into anterior cutaneous and lateral branch of the iliohypogastric. Sensory function, posterolateral gluteal skin in the pubic region. That's the function of it. Okay.
I've heard that these nerves originates from the loops between ver- um, lumbar vertebrae. So
Yes.
i-
So
is it just L1 or T12 and L1?
you have for iliohypogastric nerve, the root is L1, but some contribution comes from T12.
Okay.
Okay. All right. That's the first thing. The second one is ilioinguinal. Yeah. Ilioinguinal. From the same root. The ilioinguinal follows the same course of the iliohypogastric nerve. Same course. Um, what it does, it innervates the muscles of the anterior abdominal wall. Okay. And it will pass through the inguinal ring. But what it does see, it goes all the way towards your genitals. So what it will do, it will innervate the skin of the genitalia and the middle thigh. So innervation innervates the middle thigh and the genitalia, ilioinguinal nerve. So now we know from the root L1, we have iliohypogastric and ilioinguinal. Okay. So now, what motor function does the ilioinguinal have? It will innervate internal oblique again and transverse abdominis again. So both ilioinguinal and iliohypogastric have the same motor function, innervating internal oblique and transverse abdominis. The sensory function of ilioinguinal, it will, as I said, the inner of the thigh and the genitalia in both males and females. Skin of the genitalia. Okay. So far, so good.
Yeah.
Okay. I'm going to show you this one. So far, we have finished. That's the lumbar plexus. You have T2, T12 contribution, L1, L2, L3, L4, and L5. So far, we have covered iliohypogastric and ilioinguinal. Both have contribution from T12, but they both arise from L1. Okay. Now, next, we're going to go to genitofemoral, arising from L1 and L2. Okay. And I will show you here what I mean. The next one is genitofemoral, arising from L1, L2, and L3, L1 and L2. Whereas this is L1 and this is L2. So that was the one. Here we go, genitofemoral nerve. That's the genitofemoral nerve. And the genitofemoral nerve, as I said, arising from L1 and L2. The motor function, something called cremasteric muscle. That's interesting. I don't know what the cremasteric muscle is. Cremasteric. Ah, yes, I remember it now. The cremasteric muscle is the muscle. Let me show you. Let me show you. It's found in males and it helps ascend the testicles of males. When it's cold or something like that, the testicles elevate. So you can see it here. Here, that's the cremasteric muscle. That's the muscle that controls movement of the testicle. Okay. And so the genitofemoral main motor innervation is the cremasteric muscle. And it arises from where? L1, L2. Give you genitofemoral. The sensory function innervates anterior part of the scrotum or the pubis or labia majora in females. So in basically also genitals and also the anterior thigh, as we see. You can it just makes sense. L1, L2 comes down and innervates the genitalia and also sensory function of the thigh. Cremasteric because it controls the movement of the testicles in males. Then we have lateral cutaneous nerve of the thigh. Lateral cutaneous nerve of the thigh arising from L2, L3. It's L2 and L3. Let me see. I'm not sure if it's this one. Cutaneous nerve of the thigh from L2 and L3, so it's probably this one. Yes. So this nerve, it supplies, is purely sensory. It enters the lateral thigh aspect and provides cutaneous innervation of the skin. Arises from L2, L3. It has no motor functions, just the skin. Okay. And we are here, just to show you. Here, T12, L1. You have iliohypogastric, iliolymphatic, ilioinguinal, and then genitofemoral. And then from L to L3, you have the lateral cutaneous here. Okay. Now we're gonna dive into L2, L3, giving rise to femoral nerve. And then we go into the femoral nerve. The femoral nerve, it's here. L2, L3 is this one. Isolate. The femoral nerve, roots arising from L2, L3, L4, L2, L3, and L4. Motor functions, it supplies muscles of the anterior compartment of the thigh, hence iliacus, pectineus, sartorius, and quadriceps femoris muscles. And the sensory functions, it innervates the skin on the anterior thigh and medial leg. Okay? Medial thigh, anterior thigh, and medial leg. And finally, we have the obturator nerve. Let me see if I can find the obturator nerve. Obturator nerve. Where's the obturator nerve? From L2, L3, and L4. That's the femoral. Mm. Hi. That's the obturator nerve. The obturator nerve arises also from L2, L3, L4. Innervates, in this case, because obturator, so obturator foramen, the medial thigh muscles, hence obturator externus, adductor longus, adductor brevis, adductor magnus, and gracilis. This is the motor functions of the obturator nerve. And sensory innervates skin over the medial thigh. That's it. This is the obturator nerve. Now let's just go into the book and show you exactly what I mean. That's the lumbar plexus. You can see L1, L2, L3, and L4, and also T12. you can see that T12 gives rise to iliohypogastric and ilioinguinal together with L1. You can see genitofemoral rising from L1, L2. You can see lateral cutaneous nerve of the thigh from L2 and L3. L2 and L3 and L4 also gives rise to femoral. L2, L3, L4 gives rise to obturator. And these are the ones that we have discussed. So the site of the lumbar plexus, as we said, it lies inside the psoas major muscle. Formation by the anterior rami of the upper four lumbar nerves, L1, L2, L3, and L4. It divides into anterior and posterior divisions. Branches of the plexus, you have large and small. We have femoral nerve, obturator nerve as large from L2, L3, L4, L2, L3, L4. Small branches, iliohypogastric, L1 and T12. Ilioinguinal from L1 and T12. Genitofemoral, L2 and L1. And the cutaneous one is from L2, L3. Um, this is how the roots, they can divide it in this way as well. It's the same thing. They they have a close relation with the psoas major, as we said, and these are the branches. Now they have talked and divided it into details of individual branches of the lumbar plexus. You have iliohypogastric, ilioinguinal, lateral cutaneous nerve of the thigh, genitofemoral nerve, and there's a lambosacral trunk. There's also the obturator nerve. Okay. There's also accessory obturator nerve that comes off the obturator nerve. Femoral nerve, of course. Okay. It continues all of this about the femoral nerve. And until page 93, that's where you stop for lumbar plexus. Okay. I will post this video, of course, and you can pause the video anytime you want to study this.